We're here at the Health Innovation Conference at the Venetian in Las Vegas, and I'm joined by all sorts of leaders who are transforming the future of healthcare and health technology. Joining me now is one of those leaders, Ashok Chennuru. He's a Chief Data and Digital Transformation Officer at Elevance Health. Ashok, welcome.
Thank you for having me.
Great to sit down with you here at Health, and I want to hear from you what exactly Elevance Health is and what it's doing in the space.
At Elevance Health, we serve our members and help them through their entire healthcare journeys. We serve over 46 million health plan lives, and also through our CareLon, entity, which is more focused on health services, we touch over 110 million lives. So it's a large, scale opportunity because our focus is how to improve the health of humanity, driven by data, insights, and our collaboration with our care providers, with our, like employers, and making the member at the center of everything. So what I am leading is, how do you drive healthcare transformation? By partnering with all our ecosystem partners and improving the health of our members, and also collaborating with our care providers, in terms of reducing the administrative burden, improving the affordability of healthcare, and more importantly, improving the experience of, our members.
How is Elevance leveraging digital technologies like artificial intelligence to improve the experience and outcomes?
When we talk about experience in healthcare, it is centered around how do we leverage AI to reduce the administrative friction between the payers, providers, and our consumers. For example, how do you leverage AI to simplify the prior authorization process by automating it? How do we leverage AI to improve the experience of the member in case they want to understand how to find the right care? Because helping members to find care and helping them match to the right provider, leveraging AI, how to help them get an appointment on time, is really where we are leveraging AI to improve, the experience of the members. However, in addition to the member experience, we also want to focus on how to help them on the clinical journeys, because we have so much data. The data platform I manage has over 220 million lives of data. So we want to leverage that rich data to show the providers on the care, that here is the care journey for a member with diabetes or a member who just got diagnosed with cancer, and share that information back into the provider workflow so they can take advantage of all the insights that we share with them. So that's how we plan to improve the experience.
How does that work for associates?
See, associates are, human capital. Associates are the most important, a focus for us. So, we recently partnered with OpenAI, where every associate gets trained on how to leverage, ChatGPT, and then we have customized a lot of tools, and rolled out what we call our internal version of, OpenAI, that can, help them to create good content, that can help them to do more document intelligence and kind of become a daily, daily utility tool. But training them on prompt engineering has been critical. But our other associates, we're using AI to help with developer productivity for our technology team. We are using, AI on the call center folks to summarize the clinical or the interactions on the call centers, so we can give them the right actionable information. And more importantly, we have a big care management team who work with the members and the providers to help with care coordination. So we help them summarize the medical records and actionable information. And they also share that information with the provider. So when they're interacting with the member, or when the provider is interacting with the member, everybody is looking at the same data.
Specific to your role as the Chief Data and Digital Transformation Officer, Ashok, what most excites you?
It's a great time to be in healthcare. Healthcare is one of those things where, with so much focus on digitization, AI, and care delivery opportunities, and the amount of data we have, how do you take that? How do you make it actionable? And how do you drive meaningful outcomes? So very proud of the opportunity on what we are a platform-driven approach we are building, call it Health OS, which kind of helps bridge the payer and providers together, driven by data and insights, and change the focus from administrative focus on paying claims or authorizations to more about how we are helping members with their both administrative and clinical journeys and putting the consumer at the center of everything. And partnering with providers more on outcomes, and versus just the administrative friction. And I'm really excited about that opportunity because, and the opportunity to touch a third of the nation's population too. The scale is massive.
Well, AI and data interoperability offer a lot of opportunity out there. How is Elevance ensuring privacy and security with these technologies?
Security, privacy, and transparency is very important to Elevance Health because we store, like fairly sensitive information, and with all the, AI usage and privacy aspects and even data breaches, it's become utmost important, because, we owe it to the consumer to protect their data. So what are we doing about it? Anytime we share data with third-party partners, we make it very clear on what they can do with the data and what they cannot do with the data. And a lot of times we remove a lot of the sensitive information when we share it. So we de-identify that or we mask it so that way we can limit the exposure. And internally, even within our systems, when we are building AI, we make sure that we cover the bias aspects, so the algorithms are not, unfairly, driven, and we have a fairly rigid responsible AI institute that checks with all combinations. So that way, when regulators come to, audit us, we have the transparency and, an audit.
Now, from your unique perspective, overseeing data and digital transformation, what is your advice to viewers as they lean into digital technologies for good?
I think the most important thing is the technology is changing so much. You have to be a lifelong learner. I would say in healthcare, no individual area or company can solve the problem by themselves. Build relationship, be out there, conferences like this are great. Talk about how to work with others, even with this, whether it's within our competition or our, provider partners or technology companies or care management companies. It's very important to show the power of partnership and build relationships because together you need an entire village to solve it. I would invest time in building relationships. And if you don't understand AI, if you can't understand the data, then you are limiting yourself. So you have to be data driven. You always have to be curious, learning, lifelong learner, and you have to build ecosystem partners.
Ashok Chennuru, Chief Data and Digital Transformation Officer at Elevance Health. Thank you so much for sitting down with me
Thank you for
here
having me.
at the
Appreciate
event.
it. Thank you.
Thank you.